I'm a thoracic surgeon in Syracuse, New York. I've been in practice now for 17 years. As a thoracic surgeon, I deal with tumors of the chest, in the lungs and the esophagus, and that means that I'm really dependent on x-rays. And I love the RIO because it brings me the x-rays that I need. Healthy Connections is the Central New York RIO provider, which stands for Regional Health Information Organization. It's my go-to resource for locating older studies or current studies, particularly from people that come from far away. The more complete the information set that you have, the better the decision you should be able to make. It makes it so simple to collect that information all in one spot. It used to be just Central New York. It's actually spread to be statewide. So you can make queries and get information from someone taken care of in Buffalo or down in New York City. And I've had that happen several times a year where I'm getting statewide information on local patients. And being able to find those remote results in one place just makes the care more efficient. I think my colleagues should take the time to learn how to use the RIO because the information comes already organized. And so when you get 30 pages faxed to you, you really have to sort through those 30 pages to find the 4 or 5 pieces of information that you actually need. That takes time. And when you look at the information on the RIO, I can go right to the path report that I need for the biopsy that was done in November. I can go and see that there was a CT scan of the chest that was done in August at the hospital where they were vacationing. There's just all these steps that vanish when you can rely on information that's in the RIO. One of the things that I really like is I think it provides more cost-effective care in that way, because you could just default to say, I can't see that study that you just had last week, so we're just going to repeat the CT scan. But it's more radiation exposure for the patient, it's time wasted for the patient, it's unlikely to give me any different set of information. And so getting those pictures, being able to see that information, not having to repeat tests, it really is a huge time saver, huge money saver, and it really has immediately impacted the course of treatment for the patient. It's been a lifesaver. One of the things that my colleagues would need to do is do about an 8-minute training video. I have saved those 8 minutes almost every time I'm looking for information. And so when you start to see 20 or 30 people, I probably look in the RIO 10, 20, 30 times a month. It's very helpful. I can't praise it enough.